Hi, good afternoon, everybody. I'm Dud Young from Syracuse University. So the project I'm working on is Fixation Matters, a hands-on hip arthroplasty planning lab. So the core problem, so if you look at the right-hand side, the infographic, so the core problem in BME lab, oftentimes students learn a lot of fundamentals in junior, freshman, sophomore year, and in the junior senior year, they're learning a lot of topics in silos. So this is the before. So biomechanics, instrumentation, imaging, modeling, they taught separately. So I'm teaching this is a senior lab. So I was thinking about something that is really engaging, that has a really good clinical hook that students will get very engaged, and it's also a really good platform to put all these skills together. So I picked total hip arthroplasty. So one of the reasons is because most students took a biomaterials class before, and the instructor used hip replacement. So students all love the example. So on the left-hand side, you'll be able to see femoral stem alignment and fixation. So these are femoral stem that we got donation from the hospital. A small choice in the fixation of that can lead to a lot of changes in the stem canal interface and also affect the stability. So in this lab, I'm asking the students to simulate preoperative planning. So they build a defensible story from noisy measurement rather than chasing a correct answer. So if you look at the infographic, this is what it looks like. So step number one is a multimodal evidence capture. So all the students are given the femoral stem, and they're going to do different measurement to look at the angle, the neck, the structure of it. And they're going to do a simulated fixation insertion exercise. Some of them are asked to do the cemented type, and some of them are asked to do the press fit type. And they're using different materials like thermoplastic beads and different things to do that simulation. So in the image that you're seeing is a PVC pipe. So I go to Home Depot and cut it into part of it to use it as a mock-up for them to insert the femoral stem. And they do different measurement, including ultrasound, EMG, motion tracking, and different types of mechanical tests. So pull-out force, and ultrasound will also be able to help them to visualize stem canal contact and the overall alignment. And sometimes they can see it, sometimes they can't see it. So this is really fun. And by collecting all these evidences, now we are moving on to step number two. So they're combining all these evidences to, they're combining all these modalities into parameters, geometry, alignment, and loads. So the idea of that is I want them to have traceability, which is a really important part of being a biomedical engineer, especially when it comes to design control in FDA. So every claim links back to evidence. So I also want to make sure the finite element analysis that they're doing later on are evidence-based. It is also something that is defensible. Um, so there's not necessarily a right answer, but after step two, after they put all these evidences together, in step three, they're going to use the measure angle. They're going to apply loads using they're going to pull out, and they're also going to compare it with. So some teams are doing the cemented fit, some teams are using the press fit. So they're going to do finite element analysis, stress analysis, and they'll actually look at the force. Um, um, how alignment and loading affects different patterns in stress. Um, so, um, so in the end, I think the students are more clearly they're able to articulate what each modality contributes and also the effect, the limit, and the teams are also really strengthen the assumption checking and the traceability from evidence to design. They're not really chasing for a right answer per se, but they're really looking for authentic experimentation. So in the end, if you look at the infographic, I think one of the beauty of it is really connect individual side-load experimental techniques and skills into one coordinated model. That's something that the students are doing. I'm sorry, I didn't keep track of time. I think that's probably 5 minutes.